Assalamu alaikum. Hello everyone. This is Dr. Nafiz Arna from Bangladesh. So today the topic of ours is right atrium and right ventricle. So of the heart, right atrium and right ventricle is just the initiation of the topic. So what is right atrium and what is right ventricle? So both the right atrium and right ventricle they lies at the right side of the heart. So for a better acknowledgement or for a better knowledge, we need to at least get to know about the fact right atrium contributes in what kind of structures of heart. So right atrium, we must be remembering whether it's talking about whether it's a talk about the base. The right atrium forms the 2/3 of the base. The right atrium forms the 1/3 of the base and left atrium forms the 2/3 of the base. So in the formation of base there is 1/3 contribution of the right atrium, and while the right border of the heart, you must remember the fact that in the right atrium, so this is just an imaginary line diagram from the behind or from the back of the heart. Okay, you are just watching here the base of the heart. So in from this, at the right atrium there will be opening of the SVC, superior vena cava, and there will be opening of the inferior vena cava, and this line would be the sulcus terminalis, and beneath this the crista terminalis will lie. So it also forms the right border of the heart. After that, in front there is a sternocostal surface, and at the sternocostal surface it also contributes because 2/3 are mainly formed by the right side and 1/3 by the left side. At the right side there is right atrium, and obviously that forms this. After forming these three one border, one surface, and also the base, it also has some certain characteristic features. So to know about the right atrium, we first get to know about the fact what are the parts of right atrium. So this is just a flap opening. Okay, suppose your right atrium is just like this and you have opened it like this. Okay, so your right atrium was previously this and now it is this. So this is the outside part. That means your right atrium was just like this, you have just opened it up. Okay, so your right atrium was just like this and you have just cut it up. So after the cut margin would be the outside, this is the sulcus terminalis, and inside this is the crista terminalis. And after opening this portion, the portion you are watching my fingers, my palm of the hand and the fist or the thumb. So if you consider this is the anterior wall, that's rough anterior wall, this is the posterior wall, that is smooth posterior wall, and this is the septal wall. These three walls are the divisions of right atrium. So for right atrium and the rough part is the outflow part, which contains crista terminalis, which contains musculus pectinati, or these all are the muscle layers that are present in the transverse direction from crista terminalis towards the atrioventricular orifice. And this is all about the rough part. So the rough part, this is the cut margin basically. If you just close it up, so the anterior surface will contain a sulcus, and beneath this we will get a crista portion. That is the sulcus terminalis outside and crista terminalis inside. This is all about the rough outflow or the atria proper or the pectinate part. For if we talk about the smooth part, the inflow is totally smooth, because we get to know about a fact. Whenever I will discuss about the development of the heart, we will get to know the fact that the smooth part always derives from the cranial most and caudal most areas of the primitive heart tube, and the rough part will always derive from the middle portion. And the middle portion, if you get to know about the fact, from caudal to cranial we will get horns of sinus venosus, then primitive atria, primitive ventricle, and then furthermore the bulbus cordis. So the mid portion will always cause the formation of the rough part, and the outermost portion will always contribute in the formation of the smooth part. So the smooth part is that part which will always contain vessel, because for a vascular supply or for the flow of blood in the heart, that part, the flowing part or the vascular vein has to be smooth for a smooth flow. So there are certain openings. At first there is SVC opening at the upper part of the, this is the quista terminalis. At the quista terminalis there is IVC opening, inferior vena cava opening at the lower part of this smooth interior or smooth inflow, and that is guarded by a eustachian valve. And this eustachian valve is rudimentary because at the intrauterine life it has an advantage. Whenever the blood was coming from the extremity, inferior extremity, to the fetal right atrium, and from fetal right atrium we all know that there is a shunt present, fossa foramen ovalis, which will and the blood will cross that barrier to enter into the left atrium. So as the blood flow was very much required from right atrium to left atrium, to prevent the regurgitation of the blood from right atrium to the inferior vena cava, a valve was required, which is eustachian valve. That is, eustachian valve is rudimentary in adult life. Another one is opening of the coronary sinus, and the opening of the coronary sinus will be guarded by a semilunar valve known as the Thebasian valve. So if you look closely, the opening of the coronary sinus lies just between the opening of the inferior vena cava and the septal leaflet of the atrioventricular orifice. The superior vena cava at intrauterine will also be guarded by a valve, and this valve will later on remain as a intravenous tubercle of the lower, at the lower portion. Just look at the dark portion, that is the intravenous tubercle of the lower. Moving forward, there will be vena cordis minimi. Whenever we will talk about the venous drainage of the heart, we will get to know about the fact that anterior cardiac vein, vena cordis minimi, and coronary sinus, these are the major three venous opening of the coronary circulation. And the last wall, that is the septal wall. Septal wall is very important. At the septum, at the intra-arterial septum, we will prominently show just a shallow depression known as the fossa ovalis, which is a derivative of or remnant of fossa ovalis. And at the lower portion there will be a ring shaped structure guarding this fossa, that is annulus fossa ovalis, which is a derivative or remnant of fossa foramen secundum, septum secundum. So moving forward, there will be an important structure, that is Koch triangle, and the apex of the Koch triangle, AV node, will be lodged. So the Koch triangle, just look at the figure, it is very easy to understand. It will also help you in physiology. At the base will be formed by an imaginary line going towards or going from the base of the opening of coronary sinus. So opening of the coronary sinus from an imaginary base. In front there is a septal leaflet of the atrioventricular orifice, and above there will be subendocardial tendon of Todaro, and this imaginary triangle will contain anterioventricular node at its apex. So this is all about the right atrium.